Well, we of course want to see all of our patients make it to 80 and 90 in great shape and feeling really well, and we always tell them that that's our goal. We want them to be old people feeling well, doing well. Now, depending on what type of heart problem they were born with, that may or may not be possible for everybody, but and this is where sort of the individualized approach is so critically important, sort of determining what is safe for that individual patient from an exercise prescription point of view, and also sort of what special dietary restrictions may be considered for their particular heart problem, and really getting them to live as long and as healthy as they possibly can. We are seeing young infants who, years ago would have never made it to teenage life, and now here they are, they're teenagers or they're in their 20s, and they are interested in pregnancy and family planning, and that's something that we really spend a lot of time counseling and thinking about to make sure that they can very safely, move through pregnancy. Everything is continuously changing in the congenital heart field. I think as our techniques improve and our technologies and our surgeries improve, the data that we had from 20 years ago about average life expectancy now may be totally different. And I think as we continue to evolve in our surgical techniques, we also need to continue to study what this means for the long-term outlook for patients. Sometimes we tell patients, years ago maybe we would only say X number of years, but now who knows? You could be 100. We don't know, and we hope that you do, and we're here to help you get there. I think we'll see an increasing population of older congenital heart patients who are getting into their 50s and 60s, 70s, and 80s, and we'll be seeing the acquired heart problems now superimposed on the congenital heart problems, so coronary artery disease, arrhythmias, congestive heart failure, and how does that impact them when they have the underlying physiology of their congenital heart problem. So I think these patients are going to be getting much more complicated and complex in their management. We already see that, the pediatric population sort of graduating into the adult cardiology fields, they're more complex. They have more organ systems that are involved because those kids wouldn't have otherwise made it years ago. So I think we'll see that similar type of transition to increasing complexity in our adult and older population. Certainly it means that they'll need to have a connection with adult congenital heart providers to help with that process. It's amazing, and I think the wonderful thing about taking care of these patients is the patients and their families are just so appreciative to be alive and to have the opportunity to be alive and to make it into adulthood and to think about having families and this sort of thing. And they're patients who really are very invested in their care, very invested in the relationship they have with their doctors, and invested in sort of doing what they need to do to stay healthy for a long time because they know they've essentially gotten a second shot. So it's a wonderful, wonderful feeling to know that you're part of that process and taking care of them and allowing them to be healthy.